Missed my introduction. Good morning and welcome to today's wellness webinar hosted by the First Nations Health Director Association. I would like to acknowledge the many traditional territories in which we're collectively gathering today. I am joining today from the proud member of the Lil'wat Nation in the Statliam Traditional Territory. My name is Jessica Frank. I have worked for Lil'wat Nation as the health director for Lil'wat Health and Healing since March 2019. Also, I'm currently an active member of the First Nations Health Director Association Board and the Vancouver Coastal Southern Statliam Health Regional Table. Today, we welcome Kim Louie, FNHDA Field Supervisor for the Vancouver Coastal Region, and then Samantha Narayan, forgive me, our Regional Health Survey data collector to present on the Regional Health Survey. I'm very excited to learn more about Kim's Kim's update on the regional survey and the importance of why we need to participate. So I'll pass it on to, is it Kim first?
Yes, thank you, Jessica, for welcoming Sam and I today. Sam is the field supervisor for the Regional Health Survey for Fraser Salish, and I'm happy she's here to join today, where we're going to co-present information about the Regional Health Survey. So maybe I can start by introducing myself and then pass it over to Sam to introduce herself. So my name is Kim. I'm co-Salish from the Tla'amin Nation, and I've joined First Nations Health about a year ago as the field supervisor for the Regional Health Survey for Vancouver coastal communities. So my role has been to reach out to the Vancouver coastal communities and provide an information session to leadership. And so I've been invited to the chief and council meetings to provide the same presentation that we're going to provide here today. I've provided that presentation with leadership for the majority of the Vancouver coastal communities. And so far we have about half of the communities who have agreed to participate in the Regional Health Survey. And so my next steps would be to reach out to the membership clerks to gain access to the membership lists. And and so we'll, I guess, talk more about that in our presentation today. I'm also calling in from my home community of Tla'amin here in Powell River, and happy that we're able, you've invited us to join you today. Samantha?
Good morning, everyone. My name is Samantha Narayan. I am zooming in from the unceded ancestral territories of the Katzie, Kwantlen, and Semiahmoo Nations, otherwise known as Surrey. My people are the Kwakwaka'wakw of Northern Vancouver Island. And like Kim said, I am the field supervisor in the Fraser Salish region for the Regional Health Survey. Just want to say thank you for having us here today to give you guys some information on the Regional Health Survey.
Okay. So I guess we can move right into the presentation. I will share my screen with you. One sec here.
Looks good.
Okay, good. So as we mentioned, we're here to provide a presentation or share information with you about the Regional Health Survey. Right now we're in phase 4. And so we'll be sharing information about phase 4 of the survey. Here. The Regional Health Survey is a survey that happens every 5 years. And so you'll see here that the pilot began in 1997 and the phase 1 began in 2002, phase 2, 2008, phase 3, 2015, and currently in phase 4. It's a First Nations led and governed national health survey in Canada. And it's conducted according to the First Nations principles of OCAP. And for this year, we'll be inviting all First Nations communities to participate here in BC. And it is this year is coordinated by First Nations Health Authority. So the goals of the Regional Health Survey are to understand how First Nations communities are doing through indicators of health and well-being, to measure the determinants of health and well-being, and to evaluate existing policy and programs. And it also can assist in designing better policy and programs. Using the RHS4 data. So these are some examples of how the data can be used. So it can be used for community level health planning, program and project evaluation, informing policy, identifying areas for future community-led research or data collection, and support grants and funding applications, as well as community development and nation rebuilding. So we have heard of communities using the data from the Regional Health Survey to, I guess, inform their 5-year health plans. So it's just examples of how data can be used. And the next slide is RHS data in action. So here we've listed some examples of how data has been used on a regional and provincial level. So the data has informed reports, some reports that are listed here, such as population health and wellness, excuse me, in plain sight, diabetes report, the Indigenous Women's Health Report, and so on. And on national level, some areas of impact include the Aboriginal Diabetes Initiative, the Aboriginal Head Start Program, and Children's Oral Health Initiative, Maternal Child Health Program, and the National Aboriginal Youth Suicide Strategy. So as I mentioned earlier, we're currently in phase 4 of the Regional Health Survey. We anticipate data collection to start in March. So for those communities signed on, we'll be requesting access to the membership list so that we can create a random sample of participants from your community. And we'll share some information about random sampling later on in our presentation. So we are inviting all First Nations communities in BC to participate in the Regional Health Survey to build a data set that is representative of BC's diverse and unique culture. So we have hired data collectors. So we have 5 field supervisors, and in each region we've hired 4 data collectors. And also each community will hire a community navigator. The community navigator will help us to connect with participants to be interviewed in the Regional Health Survey, and we would look to leadership to help us to hire the community navigator. And here are some sample sizes for each region. So you'll see Fraser Salish, our total sample is 1,768. Interior 3,770. Northern 4,333, and Vancouver Coastal 1,281. Vancouver Island 3,326. And you'll see how many adults, child, and youth we plan to survey in each of those regions. So a sample is a group selected to represent a larger population. Before it is selected, the study team makes rules on how each group or how the group will be selected. So when everyone from a larger population is selected, it's called a census. We won't be inviting everybody to participate in the survey. It'll just be like a small amount per community. So why do we sample? When we need information from a large group of a population, so we have more than 50,000 First Nations living in their home communities in BC. It is impossible for us to include all First Nations community members within Canada because of the financial cost, human resource limitation, time limitation, and authority and consent would be difficult. And the rules for selecting communities and people. So in BC, the RHS sample rules for BC is all bands and First Nations are invited to participate. And then within each community, as mentioned, we will select a random sample of members to participate. So each community, we've identified how many children, how many adults, male, female, will participate. And once we do have a community participation agreement signed, we would work out those details with the membership clerk, and we also do work closely with the health director and communities as well. So for communities that are 80 members or less, we would invite every community member to participate. And our target population this time is First Nations people living on reserve. And I'll pass it on to Samantha from here.
As Kim has mentioned, the survey is for the entire age span. So we will be surveying children, youth, and adults. And the adult category is split into 18 to 54 and elders who are 55 and plus. So we also include here just a sample of what the questions on the survey will be. So we're looking at like general health, culture and language, primary care, physical activity, water quality and substance use, mental wellness, diabetes, community wellness, food security and nutrition. We'll look at residential schools, housing conditions. This survey will include the impact of COVID. A lot of consideration has been made in planning this project because we were in the middle of the pandemic. We'll also examine vaccine coverage. So what we're really looking at is to get an overall picture of health and wellness. We're not just looking at the Western ideas of what health and wellness is. We're looking at what Indigenous ideas of health and wellness are as well. Next slide, Kim. So like I had just mentioned, because of COVID, there's some things we've had to consider when planning how to implement this survey. In that is the data collection plan. So we do have 4 options for data collection. The preferred option being online surveys, where the participants would complete the survey on their own in whatever location worked for them. This mode would require an internet connection. Kim mentioned that we have hired data collectors. We'll also have the option of phone surveys, which the data collector would conduct with the survey participant over the phone. We can also have paper surveys sent out to communities, which would be one of the ways in which we could utilize Community Navigator. They would help us deliver those surveys to members in the community who are participating. And the final option, and this option would be at the request of community leadership. We can have our data collecting team come into community, and that would be arranged at the convenience of the community if that's what option they would like. Next slide, please. So for this survey, there are 2 levels of consent that we would obtain for communities to participate. The first level would be community consent, and that would be obtained through a community participation agreement or a signed band council resolution. And so everyone is aware band council resolutions would be signed by chief and the councillors. Or we could also have a community participation agreement signed. And the signatories on that would be someone who's authorized by chief and council to sign on their behalf. Next slide, please. So the second level of consent that we would obtain would be from the participants themselves. So members can choose to participate by giving their informed consent. We also have mechanisms in place to obtain what is called assent from participants who are minors. We would first obtain consent from their parents, but then we would also ask the children and youth themselves to answer whether or not they agree to participate. That would also include participants who might be living with conditions which would limit their comprehension. So someone who's possibly living with dementia or an intellectual disability. Members always have the choice not to participate, so they can decline right at the start, or if they begin the process and at some point during the survey decide they would like to withdraw their consent, that is also allowed. This consent is obtained after obtaining consent from community leadership. Next slide, please. So informed consent is obtained when understanding enough about the survey and its risks and its benefits, so the person can make an informed decision whether or not they would like to participate. Like I just said, consent is ongoing, so participants can withdraw their consent at any point in the survey. An assent is agreeing to participate when consent cannot be given based on simplified information about the survey. So this person will need someone like a parent or legal representative to consent for them. Next slide. So data return options, like Kim mentioned, the survey is being conducted under the principles of OCAP, which are about the ownership, control, access, and possession of the data itself. The planning were to maximize community level data return. We're aiming to be more transparent in this phase of the survey about our ability to return data. So there are circumstances in which there's guaranteed data return. So at a provincial level, we're guaranteed to have the data returned to us. At regional levels, we will have data returned. The sub-regional and community level data will have to meet some conditions in order for us to provide some data return. So we would need more than 60 participants in order to return data at a community level. But we also have the option in the Band Council resolution or the participation agreement to return data at a sub-regional level, which you could pair with other communities who are from the same language family, or if you're on a tribal council, on the same tribal council or nation. And so when communities have similar circumstances, they can enter into an agreement together to receive the data. Next slide. So some examples of when we're able to return data at a community level, and how the data has been used to support the health and wellness of First Nations communities in British Columbia. I believe Kim already mentioned the data from the previous phase was used in the 5-year evaluation and community health planning. So opinion-based question was very helpful. So people feel they have control over solving their own problems. They're emphasizing community strengths and building upon these strengths. The data was also used to support health program planning to determine how much funding, time, and personnel to direct to different areas of healthcare. And for the data that we could use, it was very helpful. A tangible outcome was created from the use of this data. Could you please describe it? So these are some questions that we've had in the past. So for example, it was used in the 5-year evaluation plan or the 10-year community health plan. It was also used in the 5-year mental health and wellness plan. So we have quantitative capacity on our team. We have a data analyst who can work with communities on returning the data. So we'll be incorporating the data into our community health evaluation. That was from the previous phase where they used it in 2021. So we've built in a lot of accountability measures so we can ensure that we're doing our work in a good way. We are guided by First Nations led advisory and ethics review groups. The RHS4 is being reviewed at the FNHDA and at the provincial and national levels for its research ethics. The majority of field supervisors and data collectors on our team are BC First Nations. So we're bringing cultural experiences and training with us to ensure we have some cultural safety and humility built into our team. We've added measures to keep participating members safe and well. So that would include privacy and confidentiality agreements that our entire team has signed to ensure that information stays private and secure and protected. We will not allow participants to be identified. And we've mentioned a couple of times, we honor First Nations principles of OCAP, so ownership, control, access, and possession. And we're trying to be very transparent about our ability to return data. After the last phase, we discovered that there were some measures that we needed to include in this phase to ensure communities understood the conditions in which data could be returned to them. So that is the information we have for you today. So if there are any questions that anyone has, Kim and I can do our best to answer them for you.
Do we have any questions for Kim and Sam on their presentation for the Regional Health Survey?
It's Orla Labordi from Whispering Pines. I'm the health director here. I was just wondering, one of the, at the beginning of your presentation, it said that the survey was for mostly on reserve now. Is there going to be a phase where the off reserve will be looked at? Just a question.
Yes, we're hoping at one point, hopefully it could possibly be the next phase. There's just more logistics when considering off reserve populations. And so it is on the radar because we see the importance of reaching off reserve populations as well.
Thank you.
Millie?
Hi, good morning.
Oh,
Sorry,
muted.
from the, I am the Kwok engagement coordinator. I'm just putting it out there for whoever's within our region, able to assist. We can connect. We can host some sessions together if you want, or I'm open to helping, so just connect with me.
Thank you, Millie.
Do we have any other questions, feedback? Kim, I'm in the e-blast. I just wanted to mention, is there, are the gift cards given out to participants?
Yes, gift cards will be given out to participants, and we would, I guess, select gift cards based on whichever location or your community decides would be best for your community members. Like say it was Save on Foods or something in your community, we would look to you to help us identify which gift card was best.
We have a comment in chat. Can we share the PowerPoint out?
I can send you the updated version, and yeah, we can definitely share that out to everybody.
Thank you.
I think our contact info is in the chat as well, so if anybody had any questions, feel free to reach out to us.
If there aren't any more questions, Jessica, we can close the meeting. Thank you.
All right, thanks, Karen. I wanted to start off with some closing remarks. What information that I received from your presentation. It's amazing that you have 50% participation in the regional health survey for phase 4. I think we need to push for more participation for First Nations communities living on reserve throughout BC. It is a truly amazing experience to go through. I helped with the first and second phase, and the third phase, I missed that phase for helping during that situation. And then I also wanted to recommend as well, tell your fellow health directors, leadership, that this is an important piece to find data and information for, as Kim and Sam presented. It is very helpful to use when you're looking at your evaluation and your community health planning, plus your mental health planning. And I just wanted to mention that the regional health survey data for, I think it was the phase 3. That data helped us with our community health planning. And one thing that really stuck out to me was when we're looking at the data that the spiritual healing was so low at 20%. And I'm hoping that that's going to climb through this next phase, because we've been doing a lot of spiritual healing in our community and hoping it increases. And so, I want to encourage everyone that to participate in the regional health survey, not only for the data, but also helps with funding grants and applications and programs and services as well. And so I just wanted to say those few words. And then on behalf of the First Nations Health Director Association, I'd like to extend our thanks to Kim and Samantha for taking the time to lead us through this presentation. And also thank you everyone for your participation in today, and enjoy the rest of your day and stay safe and well.
Thank you, Jessica. I just wanted to flag, Krista had a comment in chat. Will the results be available to communities even if they don't participate?
Oh, I think Kim was gonna.
Oh, I know that there's a regional and provincial report that communities who don't participate would have access to. Sam, do you have anything to add?
No, I that was what I was going to say. There are reports prepared, like a whole provincial report and a regional report. There's also a national report that First Nations Information Governance Center prepares as well.
Perfect, thank you. I know we have a few health directors that just joined us. So the meeting has wrapped up. We have recorded it. It will be on our website in about a week, if not sooner, as well as the presentation and some fact sheets that we sent out in the e-blast. So thanks again, everybody, for joining. I know you have busy schedules and busy days, but I do hope you have a great day and a wonderful week.